i4KIDS Start Award consists of a 15,000 voucher and direct access to the acceleration program from Barcelona Activa. So I'm pleased to invite to the stage Virginia Palacios she's the 3D Printing Global Head of New Business Incubation at Hewlett Packard, which is a company that we have been collaborating closely for the last years. So Virginia will present the i4KIDS Start.
Thank you for the invitation. And the winner is Triage from IS Global.
Thank you very much, and congratulations, Barbara. Thanks. And so now Barbara, she's going to do a short presentation to explain the project.
Thank you very much. We are very happy and grateful for this prize. I'm the scientific coordinator of this project, and you will see later that it's a huge team behind it, and I would like to thank the organization for this prize on behalf of all the team. And before I go into more detail into our project, I would like to show you a message from our principal investigator, who is Professor Quique Bassat, who could not be here today. He's in Gabon, but he was really sad not to be here, so he sent us a video.
Good morning, everyone. Unfortunately, I'm not able to be in person with you. I'm in Lambaréné, Gabon, and therefore I cannot be in person today. But I wanted to thank you for the prize we've been awarded. The i4KIDS initiative has supported our project, and we will be receiving an award that will complement very beautifully plan for the next 5 years of research, which involves the development of a point-of-care device to help us do the triage in sick children with fever. This point-of-care test is going to help us prioritize those children that really need help and help us understand which ones are the ones that are at high risk of dying in comparison to those that are at very, very low risk of an adverse outcome. We believe this is a very exciting project, and we hope you are as enthusiastic about the idea as we are, and we hope that in the next 5 years we will have a device that will help improve the chances of survival of those sick children with fever that are threatened by many, many different life-threatening infections. Thank you again, and goodbye.
So now I will give you more details about our project. This is the typical image at the entrance of a hospital in Mozambique in this case. And I would like you to imagine the clinician that has to attend all these patients in a particular morning or afternoon. There's many parents with sick children. There's very few physicians available. And with the help of also the limited nurses and health workers, they need to quickly screen who requires urgent attention by a physician and get probably admitted to hospital, and which ones can be sent home with a recommendation of prescribed treatment. This screen is not easy. They can screen maybe 250 children in a day. They have few time, no tools. So can you imagine how much responsibility and pressure, right? So wouldn't be wonderful they have a test in their pocket that can tell them objectively who is at risk so it can be prioritized. That's what we are trying to do in this project, to develop a test for triaging of fevers. Because fever is actually the main cause to seek healthcare globally, and although the majority of fevers are uncomplicated infections, few are life-threatening. The The probabilities of these patients to survive rely on the capacity of the clinician to identify them among the majority who's not at risk. But the tools we have for doing that, they are not good. They are slow, they are expensive, they require usually a lot of infrastructure and expertise, and that's why they are absent in the setting that I just showed you before. In our settings, we have them, but they are not very accurate anyway. So at the end of the day, what happens is that in both types of settings, we have triaging errors, which contributes to mortality due to infections. So as an example, more than 15 million deaths occur every year only due to sepsis, pneumonia, malaria, meningitis, all four treatable diseases affecting mostly children. Another consequence of triaging errors is the misallocation of resources. So here it shows malaria as an example to put figures into these two consequences of the issue so that we can understand the magnitude, but I could have chosen any other type of infection. So from all the malaria cases, 1% will be severe cases, but we detect as little as 30% promptly. That's what contributes to mortality, that most of the severe cases are not detected on time. Conversely, we are sending the wrong ones to the hospital because as few as 10% of the referrals to a hospital are inappropriate. That's a huge misallocation of resources, 90% of unnecessary referrals. And especially in a setting like the first I showed you, where resources are very limited. So our solution, our proposed device, it's a rapid triage test for fevers. It would work for any type of infection because it's based on host biomarkers of response to infection, which are part of common pathways of injury present in all infections. Our test will be battery powered, user friendly, and will use a drop of blood, so it can be used at the point of care. And it will be quantitative, similar to a glucometer, so that in 10 minutes the clinician can take a decision based on the levels of the biomarkers, as in a traffic light. So red light, high levels, red light, this patient is at risk, it needs admission to hospital or be prioritized. Low levels, green light, we can be relaxed, this patient can be discharged home safely. And the values in between would be the ones that really require observation for a few hours to understand whether they go to one direction or the other. So we believe that such a tool will have a big impact in both poor and well-resourced settings, just that it will be a little bit different how it will impact each of these settings. So in a poor resource setting, we will be mostly preventing mortality and morbidity and inequities in access to healthcare because they don't have tools like we have here, for example, in the sense that maybe if we have doubts, we can do hospitalization for a few hours and wait till we are sure we can send this patient home. So this preventive of hospitalization, or we can use a battery of tools to rule out things and make sure that we are safe to send this kid home. So the benefits we would obtain in a well-resourced setting like here is that we will prevent many of the healthcare costs that maybe were not necessary. Some will be necessary, but some maybe we can avoid them. And in both type of settings, we will be preventing unnecessary treatments, which will prevent also the public health harm of overuse of antibiotics and these kind of things. So recently, we have received a European project, Horizon 2021, to develop this device and test it and see whether we can actually obtain better outcomes. So the first 2 years, we will dedicate them to the product development. We will validate the prototype in the lab. So the basis of this technology is magnetic particles that can concentrate the biomarkers so you obtain high sensitivity, which is a must for this kind of test. We will validate it in the lab and we will work to obtain functional prototype that we can bring to the field. With that one, we can perform clinical trials the next 3 years. We will do these clinical trials, randomized clinical trials in 3 African sites and targeting children because they're the ones experiencing higher mortality due to infections that are actually treatable. We will recruit around 2,500, 3,000 children in each site, and we will randomize them into the intervention with the rapid triage test, where the information of the biomarkers will be included in the decision and compare it with the standard of care, and evaluate 2 days after the appropriateness of the decision and also the clinical outcomes. This project involves 13 partners. As I said, most of the clinical research will take place in Africa. It will take place in Mozambique, Ethiopia, and Gabon. The product development will be in Catalonia with several partners from our ecosystem here. And there's also partners of other European countries, UK and Canada, that will support this clinical research with their expertise either in statistics, cost effectiveness, or biomarkers discovery. So we are very happy that we won this i4KIDS prize because it will allow us to participate in the pre-acceleration program at Barcelona Activa, which will be in parallel of the launch of this huge and ambitious European project. And I think this will be very valuable for us to work on those non-scientific aspects that are necessary so that at the end of this project, this just not finish in a research, but that we can actually bring such a product to the market if we are successful with the research. We will invest the prize in freedom to operate and intellectual property studies. And to finish, I would like to introduce you the core innovation team. Kike Basanga, you have seen in the video, is the leader of this project. He's a lead expert in clinical research and trials in poor settings, especially in Africa, and has worked a lot of years trying to find new solutions to reduce child mortality. Then we have Isabel Piridori, who is an expert in biosensors. She's the one providing the technology behind our test. And Kevin Kane, who is a world expert in biomarkers in infectious disease. Myself, I will be the scientific coordinator of the European project and also taking the pre-acceleration program with the support of young clinicians, researchers in the team, Pera Millat Sojanovic, and also a technical expert that is from Isabel's lab, so that we are the team behind doing all these tasks of the acceleration programs. We will have the support of the TTOs at IAS Global and Universitat Autònoma, that they will help us with innovation and business development. So at the end of the day, what we are trying to do is to bring a device that can help health workers to make rapid and appropriate decisions that can improve outcomes of patients and especially of children in low-income settings. Thank you.
Okay, thank you very much, Barbara. That was a great presentation and a very promising project. So for the people who didn't know, the i4KIDS Start was a contest that was only among the members of the i4KIDS.